আছে কয়েকজন আছে এখানে, মানে অলরেডি ইউটিউবে গুড ইভিনিং লেখা শুরু হয়ে গেছে। তুই শুরু করবি তো?
ম্যাডাম জয়েন তো করুক, ম্যাডামকে আমি বলেছি জয়েন করতে।
হ্যাঁ, তুই শুরু করে কিছু কথা বলতে থাক, আমি তারপরে ম্যাডাম যতক্ষণ না জয়েন করছে ম্যাডামকে করে আগে ছেড়ে দিস।
তাই করবো
নাকি? হ্যাঁ,
তাই করবো।
রাইট। Okay, so hello and welcome, dear learners, to this second live session of our this course. And I guess we have a little bit of echo. Just a second. Right. So there's no more echo. So welcome everybody. So before, we go on with a bit of discussion regarding the question papers and the assignments and everything, because I guess you'll be having your exams very soon for this course. So we have some questions regarding the exams and also some regarding the assignments. We will be discussing those. We'll be discussing those in a while. But before we go on with those discussions, I would request Dr. Jha to initiate the discussion on the contents of this course, and particularly for the last 4 weeks. That is the basic purpose of this second live session. So I would request Dr. Jha to start the discussion on the contents of the last 4 weeks. Yes, Dr. Jha. Okay, I guess there are some issues. So, right. Okay, so right, we'll first then discuss regarding what are the different, issues with the question papers and assignments. As soon as we get Dr. Jha and Dr. Dobe online, we'll be shifting to those issues. Right. So the questions that we have mostly been asked in the discussion forum and also in all these, the questions that you have already asked today through the Google link is basically regarding the assignments. Now, we have already cleared it during the last meeting, and I'm again repeating the same thing. So be very careful regarding this. That the question that we'll be having in the final, the exam, they will be MCQ based, and the MCQs will be the same type of MCQs that you are getting in the assignments, right? So there is no issue of subjective questions or where you have to write anything or like that. No essay-based question, nothing. All the MCQ questions, you'll have 4 options. You have to choose the best possible, the best suited answer among the 4 options. And for yes, no, or true, false type of questions, you have to, identify true or false or yes or no, whichever suits the particular question best. And next is the issue of assignments. So many of you have asked that you have missed some assignment, 1 assignment or 2 assignment like this. So whether they will be given the certificate or not. I would again request you all to just kindly go through the homepage of this course. It is clearly mentioned the criteria for getting the certificates and everything. What you need to understand is that the assignments, the weekly assignments that we'll be focusing on is best 6 out of the 8 assignments. So now for the best 6 assignments, what you need to do is you need to consider the 25% marks from those best 6 assignments. And how this will be computed? 25% from all the 6 assignments, it will be converted to 100, and from that a proportion of marks will be calculated. 25 marks from those best 6, 25% of those best 6, from that out of 25 you need to get at least 10. So it doesn't matter whether you have attended 6 assignments or 5 assignments or 4 assignments. What matters is out of the 8 assignments, while scoring, the technical team will consider the best 6. And when they consider the best 6 assignments, the scores from those best 6 assignments will be pulled and it will be narrowed down to 25. And in that 25, you need to get at least 10. So if the weekly assignment criteria of getting 10 out of the 25 score allotted for weekly assignment is complete, it is fine. And then next part is regarding the final assignment. So I guess it does not mention clearly that whether clearing the weekly assignments will ultimately lead you to a successful final assignment or not. There is no such rule. You need to attend the weekly assignments as prescribed and also the final assignment, and then the scores will be pulled. Just remember, go through the homepage and see what are the cutoff marks. In either of weekly assignment or in the final assignment, if you do not score the sufficiently so that the cutoff mark is achieved, in that case only, so that means when your cutoff mark is not achieved, in that case only you will not be getting any certificate. Okay. And there is no criteria of like you have not attended any weekly assignment, so you'll not be allowed to enter the exam, nothing like that. If you have registered for the exam, you will definitely be sitting for the exam, but whether you'll be getting any certificate of completion of the course or any grades or something like that, it depends on the cutoff marks. So be very sure about it. And also we have one request kind of that one person, two person, they might have not been able to attend the weekly assignments. So they are now requesting us so that they can attend the weekly assignments. But unfortunately, the weekly assignments do have a deadline. Once the deadline is passed, you cannot really reattempt the weekly assignments, not at least in this session. But yes, you can appear for the final exam if you have registered, but weekly assignments, it is not possible in no way of sort. Right. So I think enough with the administrative kind of discussions, and I think the issues regarding the question paper formation and the type of questions is a bit clear now. So we have Dr. Jha and the Dobe madam has also joined. So I will now request both of them to take up the discussion from here onwards.
Okay,
Yes, if
so
you can
hello.
give me, Sweety, if you can just give me
Yes,
5,
ma'am.
6 minutes more because I'm traveling and I'll be getting up on the elevator. So I might
Madam,
lose my connection.
no
So
problem,
another
no
5
problem.
minutes later, I'll join again.
Yes, okay, madam. Okay, no problem. So hello and good evening, everyone, and welcome all the learners. This is our second live session of the course Basics of Health Promotion Education Intervention. So we have covered intervention mapping, the designing and framing of the IC materials and messages, and some digital technology application of health promotion and the evaluation of health promotion education intervention. So now the important thing is, like just now Dr. Lahiri, he has discussed very clearly about the exam pattern, the questions, and how the marks will be calculated, etc. So first of all, I request all the learners, if you have any question or any query, please write down your question on the chat box, and we'll cover briefly some topics, some important topics, like for your exam, from my end, intervention mapping, the steps of intervention mapping is important. So I think by now you are quite clear about what are the important steps of intervention mapping. So now, first of all, see the steps you have to remember. Apart from that, what is the main purpose of intervention mapping? That is very important. And I have discussed what is the need of intervention mapping, the overview of intervention mapping, the different steps. I have discussed every steps of intervention mapping in the lecture. So you all know the main purpose of intervention mapping is to develop a health promotion package, or you can plan for the health promotion program planners, for the health promotion specialist. They can plan a very systematic and very proper package, okay, intervention package. So intervention mapping, basically they provide with a clear framework for effective decision making at every step of intervention planning, and not only planning, we also have to implement and evaluate. So this is very important. And regarding steps, we all know that first of all, we have to understand the situation. So the very first and important step, okay, for intervention mapping is that you have to first conduct a need assessment, or you have to analyze the situation, or you can also say problem analysis. So this is very important. So you have to be very clear about the first step, then only you can move on to the next steps and further. So you must have a very proper planning group, okay, which will include potential program participants, and you have to plan the need assessment, how you are going to analyze like health and quality of life problems and their root causes. That is also important. So you must have in-depth understanding, you must have in-depth situation analysis of whatever problem you have targeted, or you have decided that you are going to target, or according to your objectives. And definitely, you have to remember another important point in need assessment is that you have to link the need assessment to evaluation planning, because you have to evaluate at the end. So you have to be very clear about your evaluation. Apart from that, we have other steps I have discussed about the change objectives, what are the strategies, how you are going to implement, how you are going to evaluate. So we have discussed all this in details. If you have any question, then you can post in the chat box. And I think regarding monitoring, at the end, like monitoring of health promotion and everything. So the input monitoring, the process monitoring, output monitoring, we have discussed in details. So again, you just go through the lectures, okay? So, madam, okay, madam she has joined. So, madam, a very...
Okay, I'm here.
Yes, ma'am. Okay. So, madam, can you please briefly tell us about the core counseling skills, like in health promotion?
Basically, rather than talking about first, before making a list of the skills, we have to remember that where in health promotion counseling is used, because counseling we have commonly seen as cognitive therapy or behavioral therapies of different types, etc. But also to promote health, to make a healthier life, we do have counseling in different situations in the preventive part. So adolescent counseling is there, family planning counseling is there, spacing method counseling is there. There are umpteen number of cases where you need counseling. And some of them, they require like properly trained, sociologically trained, social work trained people. Some of them we have to do in everyday situations as professionals who are working to improve health of populations. So what are they? I think all of us who are healthcare providers and who are training to become healthcare providers know that we have to talk. We have to talk with patients, we have to talk with beneficiaries. So how we talk with them, the respect, the attitude which we deal with patients is very important. And verbal and non-verbal communication comes very importantly into these communication parts. That's one part. The other important skill of counseling, because counseling is more about listening. So we are all not tuned to that. We listen less, we talk more. But let us make a point that if we are to counsel, if we are to understand, and if we are to understand what the patient or the beneficiary is not talking about, then we have to listen. The more we listen, the more we keep quiet, they get a chance to talk. That doesn't mean you keep mum. You will have to keep on joining or have to provide the threads of the conversation, but overall, the person has to be able to speak. That's so talking verbally and non-verbally communicating is important. Listening is important. Being non-judgmental is very important in counseling. In no way can you be judgmental, can you be moralistic, can you say that this is wrong or this is right. Again, neither through your verbal communication nor through your non-verbal communication can you convey that you think this is right, that is wrong, or this person is not doing the right thing. No, that is not done. The other important skills also include now what you learn, what you listen to, you have to be able to summarize it. Because from time on, at periodic intervals, we have to keep paraphrasing and asking people, particularly if it is a long session, we have to keep asking people that is this what they really want to say? Because counseling again is we usually don't have people from the community or people from their language. It might be difficult and different. So that is why it's very important to check understanding. Check understanding is very important at, for the counseling, but it doesn't mean that at the end of again each answer you would say that, well, is this what you wanted to say? That's done after a period of getting the information. And then finally, what I would like to say is counseling is not advising. That's important. It's placing the options. So the choice has to be now an informed choice by the patient or the beneficiary. But the counselor doesn't say that you go and do this or you do that. No, that's not what a counselor usually does. Like, say, in the case of spacing, you provide family spacing, you provide the different options, you provide the pros and cons, you talk about her or his problems of accepting some of them, and then you tell them that considering all this, if this is what you had to say, these are out of all four, I think these three can be matched to your requirements. Now, it is up to you to decide which one you would take. That's what usually counseling entails. Now, if you have further questions, but again, it requires certain personality attributes, as I always say, a lot of patience, a lot of tolerance. These are what are required in counseling. So, I think that's about it. And it's, though it's not a large list, but it's a very intensive list, I should say.
Yes, thank you so much, ma'am. And madam, what about the different mass approaches for health education?
Now, the mass approach for health education is usually approaches which utilize communication methods to reach masses, to reach a large number of people in a short time. So, when do we choose the mass approach? Now, what are some examples of mass approaches? Having a mass meeting, or choosing perhaps to mic around a large fair or festival, or having choosing mass communication methods like the radio, the TV, the newspaper, etc. When do we choose these, and what are the pros and cons of these? I'm sure this has been discussed already, and we all know that because there are lots of people in a smaller span, these approaches are all labor intensive, money intensive, so it cannot be done for huge number of people for a very long time. So what we tend to do is give smaller messages, more specific messages over a short period of time to just make people aware of a certain issue. Suppose you just want to tell them that on such and such date a particular immunization is going to be given to your child under 5 years of age. So that's just what you can do. But this has to be perhaps in some cases be backed up. Now people will have a lot of questions in their mind, whether at all they are eligible, where should they go, how should they take it. For these, the approach then needs to be more intensive. Move to group, then move to individual, etc. Mass approaches are used mostly because we need to inform large numbers of people about one particular thing in a short period of time. A flood is about to happen. A disaster is impending. a pandemic has been declared. These sorts of things we usually do through mass approach. But as it's evident, mass approach will not clarify all doubts. Mass communication has these difficulties. So for that, we have to move on to other approaches at subsequent stages.
Thank you, madam. And last, we all would like to know how role play and skit, they are different things. So there are people who often get confused. So please throw some light on this issue, like
Yes.
role play and skit.
Yeah, it is pretty sad to see still people performing skits or street plays and saying that those are role plays. The very word role play implies what it is about. Each of us assume different roles in life, in profession, at home, out where we work, etc. So here, who is playing the role? The participant audience is supposed to play the role, not the people who are organizing it. So the roles, there are certain assigned roles, say the assigned role of an asha, or the assigned role of a mother, or the assigned role of a doctor or a nurse, whatever you have designed or thought about, or through the needs assessment a problem has come up. So you now decide which are the roles you want played. The organizer or the educational intervention will now have to first decide which roles you want played. Having decided that, you would also have to decide what you want to convey through those roles. What is it that you want corrected? Usually we choose attitudes. Attitudes to be corrected are reflected through role plays. For information, you can choose other types of intervention, but role play is usually done for attitudinal changing. So how do you do it? In a skit, we rehearse, we are given assigned parts, we make a script, we rehearse, and we go and do it. In a role play, the roles you have decided. Now, what we usually do is we go and ask some of the participants to volunteer to do the roles. It may be that a male will do the role of a mother. It may be that a female will do the role of a male, whatever. That is immaterial. But they will choose by lottery. Usually we do by lottery so that people don't know what they are supposed to do. Now we just give them a couple of minutes to think about what they are going to do. Not together, not let them sit for half an hour and decide on what they do. No. Just 2-3 minutes to decide what they are going to do based on their own experiences. And then you ask them to perform it. Now a role play usually should not be more than 5 to 7 minutes. It should be just one short enactment of what is really happening out there in the field according to the participant. Having done that, you stop it. Now, for any of these live interventions, we require a debriefing at the end. So, as soon as the role play is over, you ask the participants, now what did you see? What do you feel about this? Each of them would talk something, would say something, good, bad, right, wrong, something. So, then you ask, what could have been done differently? And you can get these people to enact once again, or better still, to have another set of participants to do another role play to do the right thing. So that differs from that of a skit. A skit doesn't have these options, and neither should it. It involves the audience, and the audience doesn't have time for introspection. That is this the thing which I also do? So I should be changing. Or is this the thing which I usually see? So these things should change. So that's how role plays are different from skits.
Thank you so much, ma'am. I just want to ask you one question. Like in role play, there will be some people who will observe, and
Yes.
they can also participate in the discussion later, right?
Yes.
Okay.
They can participate in the discussion. You can also make them do another role play on the same thing, just to do it in the way they feel it should be done.
Thank you so much, madam. Thank you so much. Dr. Lahiri,
Yes.
yes, you can discuss here some of the topics which you have taught.
Yes, sure. So Like as I've already said, in today's live session, we'll be mostly focusing on the last 4 weeks of this course, right? So since this is the last live session and also the exam is very nearby, so those of the learners who are actually listening and who will be later seeing this, recorded version of this session, I will just let you know what are the some of the important topics for the exams, because that is the most of you are mostly concerned regarding the exams, and so we'll be focusing on that as well. Now, for the last 4 weeks, see, we have different topics covered. Like we have covered how to develop good health promotion messages and how to deliver them. Then we have very briefly covered how the technology is, taking over some of the traditional methods of health promotion and how we can utilize those technology-based designs of health promotion. So we have covered those. And we have also covered how to validate a particular intervention. So before we discuss something about the quantitative aspects of analysis of the health promotion intervention, I would just briefly focus on how a particular intervention should be assessed before it is rolled out. So the thing is, you should know how to pretest a particular intervention and what are the typical things to look for when you are pretesting a particular intervention. See, in the course, during the lectures, I've mentioned many different points, but in reality, when you go out and check for whether the intervention that you have designed, it is valid or whether it is implementable or not, you should look out for what intervention you have designed, whether, as madam was mentioning, whether it is for the individual, for any individual one is to one intervention, or for a group, or is it a mass approach. So this is first consideration. So your intervention should basically be based on this. Then you have to considering the nature of the intervention implementation, whether you have put in all the right ingredients. The right ingredients means the content should be as per the type of the intervention. Like for a group approach, see, for an individual approach, the content you may tailor it in terms of individual needs. But for a group and a mass approach, you need to be more general, or you need to put something that is more catchy to a group of people, and people will ultimately understand and retain those stuff. So another important thing is design something that they can retain. So this is another thing that when we are developing and implementing the intervention, we should keep these in mind. The other important thing is whether the intervention that we are planning to roll out is acceptable to the community. And by far, from our experience, this is the most important consideration when you're developing any health promotion intervention for any community. Because if the intervention is not acceptable to the community, you cannot do anything. You cannot move, even to whether to format the particular poster or some banner or something like that, you cannot do that because the intervention, the content of the intervention is not accepted by the community members. So that is one of the very important aspects. And also, you need to remember whether the intervention, particularly the print materials that we use, the posters, the banners, whether they are of appropriate size, whether they are attractive. So with attractive means they should be eye catching and people should be engaged with those interventions, because in health promotion, engagement of the community is again very important. And so for that, those materials that we use in our interventions, they should be catchy. The fonts that we use, we have mentioned in the text, but again, I'm repeating because these are all important for the exams. The type of the font, the size of the font, and what type of font. We have mentioned that it is better to use those straight kind of fonts without those small foots like what we call a serif. So these are the fonts that we use for, a vision of a poster from a very long distance. Because if you have sufficiently large text size and you can see the particular intervention material from a long distance, it is better that the impression of the particular content will be there in the viewer's mind, and people will not tend to miss the intervention that you have given in some places. So these are some of the important concepts that you need to understand. These are mostly, based on the common sense, but you might need to go through the lecture materials that have been provided to you before you appear for the exams. So these are regarding the contents and how to deliver them and what to check before, rolling out the particular intervention. Now, after rolling out the intervention, again, what is very important from our, point of view is to understand whether the intervention that we have implemented is effective or not. So there is one concept of effectiveness and there is one concept of evaluation. So now evaluation is again a very interesting concept and perhaps one of the most interesting parts for any health promotion program, because based on your evaluation, you can redesign, the whole package. So now, for evaluation, what we usually do is we usually, we have given questions on 4 types of evaluation, right? So formative, the process evaluation, impact and outcome. So these evaluations, these are based on when we are evaluating the thing. Right. So, for example, formative evaluation. Formative evaluation, I'm just giving us some examples. Formative evaluation is basically done before actually implementing the intervention. So, it is done beforehand. You're formatively assessing whether the intervention is going to be effective or not. And also, you are doing some other things. Then, process evaluation, as the term suggests, process means we are evaluating the whole process, how the intervention is being implemented. That is for the process. Impact means we are trying to assess what can be the impact, what are the impacts. And outcome means it's kind of a long term. So again, impact and outcome evaluation. This is another confusing area what you need to understand, and questions are given from these 2 areas, just interchanging impact and outcome intervention. You need to very, very carefully remember which one is for long term, outcomes and which one is on a shorter term basis, right? So this is again an interesting part. Now, you see, just to clarify, because impact and outcome evaluation seems to be confusing to many of you. See, we have mentioned in our lectures that impact evaluation means it is basically depending on the secondary outcomes. So secondary outcomes, or in other words, what we call is they are proximal outcomes. What we can have, very soon after implementation of the intervention. But outcome evaluation, it mostly focuses on the primary outcome. And remember, in health promotion, this is how you remember the difference between impact and outcome evaluations. In health promotion, since we are mostly focusing on the behavior of the beneficiaries, changing behaviors takes time. And after even changing the behavior, actual effect of that changed behavior, that also takes time. So, if we are implementing a health promotion intervention, that means to ultimately observe whether the final goal is achieved or not. That final goal is very distal in nature. That means you can see the final effect. For example, if you are focusing on a diarrhea prevention program, for example, you want to reduce the cases of diarrhea in a particular area, and you are giving some hand washing intervention and like this. These are routinely usually given in our health programs. But when you are first giving this intervention for the first time in a particular community, then for the community to accept it, then practice it, and ultimately to lead to the reduction in the number of diarrhea cases, it takes time. For example, you can assess whether the cases of diarrhea is actually reduced or not in 1 or 2 years. So here, this reduction in number of cases of diarrhea is a distal outcome because it is a 1 or 2 years kind of thing. This is quite long from implementation of the particular intervention. This is outcome evaluation because this is the primary aim of this intervention, to reduce the number of diarrhea cases. So this is primary thing which is observed usually in a distal course of things. So this is outcome evaluation. And impact means what you get immediately, which is very proximal to the timeline of the intervention implementation. What you can have is whether the beneficiaries are practicing hand washing or not. That you can observe, right? So these are a couple of examples to just make you understand what is the difference between impact and outcome evaluation. Just don't get confused. Remember these few things, and I think this will be very much easy for you in the exams. And another topic that I would focus on today is regarding the health impact assessment. See, health impact assessment also, I'm not telling that you'll be getting many questions from this particular topic, but still I'm focusing on this because even though the questions are not much, not plenty of questions are there from HIA, but still it is a very important concept, and from this course, you should at least be very clear regarding what actually HIA or health impact assessment is. Okay, so we have mentioned that health impact assessment means, see, here the term impact, it is not similar to what we call in impact evaluation. So this is what you need to understand. In impact evaluation, we are concerned regarding immediate outcomes or proximal outcomes. But health impact assessment means this is a consolidated approach. Ultimately, what benefits does the intervention package giving to the community? So this is the motto of health impact assessment. Okay. And for health impact assessment, what you need to understand is um, health impact assessment is again a particular concept for which the community resource is needed, because you need the understanding from the community in understanding or having the foresight for that particular intervention. So it is kind of a both way thing. Health impact assessment, you cannot simply just implement the intervention and say that, okay, I'll assess what benefit is there and I'll quantitatively report that these are the benefits from this particular intervention. No, health impact assessment, it's kind of a mixed method thing. So you have some quantitative indicators and you also have some qualitative inputs from the community members, from the 11 persons who have implemented the intervention like this. So this is another important concept regarding health impact assessment. Now, after this concept, the basic concept, there we discussed these different steps regarding health impact assessment. So just remember them very briefly or very easily. You can remember. It's like first is screening, then you do scoping, then you do appraisal, final reporting and monitoring. Now, what sets health impact assessment apart from all other types of assessment or evaluation is this monitoring step. Because health impact assessment does not only stop after reporting. You need to monitor the situation, Monitoring phase in health impact assessment, this is particularly related to the policy implementation phase, if you consider the different phases, again, for HIA. Why? Because in the monitoring phase, you're not only monitoring whether you can have any sort of flexibility or anything can be changed or you can improve some kind of reporting or not. Not only these simple concepts are monitored. Here, you are communicating your finding back to the community and you're taking input from the community as well. And you're monitoring this back and forth process. So this is a very interesting step. And you need to remember that monitoring is kind of a particular step which sets HIA apart from all the other types of evaluation processes. Now, see, apart from HIA and these typical discussions that we have regarding the different types of evaluation, I would just request you to go through the different quantitative techniques and also the technology-driven aspects of health promotion. Because in technology lecture, what we covered was different, how online things are basically how web-based interventions are coming up and how these different the online technology is basically helping us gain a broader platform for health promotion messages. We have mentioned a few points regarding those, how to assess the acceptability or how to assess the validity of those interventions. Please go through them. And also go through how statistically we evaluate these. Although we have not discussed much in details regarding the statistical methods, but just keep in mind regarding the basic concepts of correlation and stuff like that. Okay, so I think that will be all from my end for this particular live session. Over to you, Dr. Jhan.
Okay, thank you, Dr. Lahiri. So, is there any question in the chat box?
No, I don't think so. I don't think so. There is no question till this point.
Okay. So, I'd like to say to all the learners that please go through the lectures, okay, the lecture video. Not just you will go through the slides. That will not be enough because in your final exam, there will be some questions which will be based on your understanding. So don't think that you will just go through the slides. Okay, you have to go through the video lectures. So this is very important. And if you have any question, then you can post in the chat box or you can write to us in the discussion forum. And Dr. Lahiri, do you have anything to say before the final examination?
Yes.
Last minute suggestion or something like that.
Yeah, so nothing much. We have given a few suggestions from the first 4 weeks in the previous lecture, in the previous live session, sorry. So in this live session again, for the last 4 weeks, just go through how to design the interventions, what should be the content of those intervention packages, and how do you implement it for a very acceptable method of health promotion. And that is one important part. Again, focus on the evaluation techniques, how you evaluate the theory-based interventions, because theory concepts, they have been covered in the lectures by Dr. Jha. So now the important part, after knowing the theories of different, health promotion, what you need to understand is how to evaluate them. So evaluation, I mentioned that understand the basic analytical methodologies and focus on the different evaluation techniques. Okay, the 4 different techniques, and don't get confused between impact and outcome evaluation, and don't get confused with the concept of impact evaluation with health impact assessment. So these are the things that I've discussed, and also I would suggest that you go through the slides again and again, also the lectures as mentioned by Dr. Jha. The exams are not difficult. What I suggest is you'll be having MCQ questions distributed in 4 sections. So 4 sections of 25 questions in each section. And all the sections, the questions will be mixed, not like that you will be getting 25 questions from a particular week in the first section or in the second section, not like that. The questions are mixed, but they are distributed in 4 different sections. Remember that the MCQ questions you will be attempting, you may find that there are 2 or 3 options you think that they are best suited for this particular question. But no, you have to choose the best possible solution. Most of the questions that we have given are basically based on the best possible questions. So you will not be having any confusion at all if you go through the lectures and also attempt the weekly assignments, that there cannot be more than one correct option to those questions. But if you find that there are certain questions where you think there are more than one correct options, then you have to choose the best possible option which you think is most suited to the question asked. So, for example, in yes, no, true, false question, there cannot be 2 options, because yes and no cannot be true in the same way, right? So there you have to understand that you have to choose only one option, and it's kind of a 50-50 chance. So you either make it in favor of you, or it's going to cost you, there is no negative marking, but you'll not be getting anything for the wrong answer, but still you may lose out on it. So the yes, no questions and true, false questions, please read the stem of the question very carefully. Most of the learners, what they usually do is they usually go through the different the questions that have been set in previous year's exams, but they do not focus mostly on the content of the question or the stem of the question that is there in that particular year's question. So if you do that, there is a good chance that you are missing out on what is actually being asked. Some questions may look like that they are similar to the previous year's question or the weekly assignments, and some questions are in fact similar to those. But you need to be very sure about the content, whether the question is asking all of the options that are excluding, or the excluding particular term excluding is missing in there. So these are the some things that you need to be very much careful when you are attempting this computer-based exams. Be very attentive. The questions are not difficult. Go through the questions, go through the weekly assignments, go through the solutions, and I think you'll be very, it should not be any problem for the final test.
Okay. So, any further question?
No, I don't think there is any more question in the. No, there is no question. There is no question in the chat box.
Okay. I think if you have any question, then you can write down to us. You can just write it down in the discussion forum, and read all the health behavior theories and models properly. And also the differences between IC, BCC and SBCC, that is also important. Different approaches for health education. So these are the important topics. You have to go through it properly. So I think if there is no further question, we can end up we can. Yes, Dr. Lahiri, am I audible?
Yes, I think we can conclude this session over here because we do not have any further question, and mostly the questions that were there were mostly regarding the exams and everything, and we have discussed those. Okay, I think this will be enough for this session. I think the learners will enjoy the exams because the questions are very interesting in nature and also they are very much doable.
Yeah, and all the best. And don't worry.
Right. So I think we can conclude.
Yes, I think.
Thank you.
Okay, thank you.
Thank you.
Madam, thank you, Dr. Madhumita Dobe, madam. And thank you.
So shall I leave? There's nothing enough?
Yes, ma'am.
Okay, thank you.
Thank you, team IT, NPTEL IT Kharagpur. And thank you, all the learners. Okay, thank you, Dr. Lahiri. Thank you.
Wait. Yeah, thank you very much. Thank you very much.
Yes, anything
Yes.
you have to say? I mean, I'm asking NPTEL team.
Yes, wait. Just a second. I think we have a question regarding injunctive norms. Yes, there is a question, but I think better because we are concluding here. We'll just make sure the answer is provided in the discussion forum.
Yeah, that can be done. That can be done.
Yeah, because Madam has already left, and yeah.
Okay, we'll discuss in the discussion forum. No problem.
Right. Sure.